Hi, my name is Kathy Kelly. I am an MS student at William Patterson University. And for my class, we had to do a project where we educated a group or a person on something that we decided with our preceptor for to educate or teach them a thing about nursing. So, because I'm in radiology, I decided to use PICs and midlines, the good, the bad, what you can use them for, what you can't use them for. And this also was done at a professional education day. I had a poster, which I'll include at the end, that I demonstrated different policies, different information about PICs and midlines and the differences between them. And then but prior to that, I actually asked the students 5 questions and I had them fill them out. The first question is, according to infusion nurse standards of practice, a midline catheter can remain indwelling for up to 4 weeks. Is that true or false? The second one is routine central line dressing changes, transparent occlusive type, should be performed within what time interval? Every other day, every 4 days, every 7 days for routine changes. Otherwise, the dressing is changed PRN whenever it becomes loose, damp, or soiled. The third question is, PICC lines are suitable for which of the following? Chemotherapy, long-term antibiotic administration, TPN, all of the above. The fourth question is, when flushing an adult PICC line, the minimum volume of the syringe must be 1 ml, 3 ml, 10 ml, or 30 ml. The fifth question is, when a patient's GFR is less than 30, can you have a midline or PICC line placed in the patient? Yes or no? And on my board, they had the answers to these questions in different types of different types of demonstration. I worked with my preceptor to develop this board, and also with my nurse manager of radiology to make this board. And I spent the whole day just, having people pass by, swipe their badge, say that they were there, go over this, had them fill out the questions, then, educated them. And then at the end, I had them do the questions again. So they did have to spend some time, with me. And it, luckily, because they have 3 different professional educational days, that there is not as many people as there would be when it's just one day. So they have 3 days to develop, to get these things done. But I used summative education, which is evaluating how much they have learned, rather than formative, which is how people learn. And the reason I did this is because I wanted to see if they're really learning from this, or if I have to redo how I'm doing my education. And I feel that they did learn, because a lot of them didn't know a couple of the questions, but a lot of them did. I think the one question that they did have a problem with was about the GFR. We have to get renal clearance from a renal doctor in order to place a midline or a PICC line in somebody whose GFR is less than 30. And this, is such a big deal. We do now put them in patients that are on dialysis that maybe have a fistula in their right arm, and then they have to use the left arm. But, you do need renal clearance for that, because sometimes doctors don't want their patients getting, a PIC or a midline because in case it gets clotted. And that's, part of the education. A midline is a central catheter. It tends to take the place of a CVC that is put in an emergent situation in the middle of the night, because obviously we don't work 24 hours a day. We only work from 7:30 a.m. till 7 p.m. and we don't do them on the weekends and or holidays. But if they need one for vasopressors, which that is a lot of them, that's what they need them for, they will put a central line in them in ICU. So, you have to then evaluate their illness and see if their GFR is good, if their platelets are okay, if their INR is not too high, because if their INR is too high, you can't put that in either because they have a chance of bleeding. So, these are all the educational aspects of my project that I, discussed with the nurses. And, it was nice because you could evaluate, how much they were learning with the two, test questions, the two, before and after. They were the same questions, and I didn't discuss them with them until after they were done. If they had some wrong, then I just, said to them, well, you need to know that you have to get renal clearance on a patient that's GFR is less than 30. Now, a midline is like a long-term IV. They can stay in for 30 days. And people don't realize that you can't use that for TPN, or you can't use that for, any kind of vasopressors in our hospital. Although my preceptor and myself we were working on a plan to educate people about the use of vasopressors with midlines. And I explained that to some of the ICU nurses because the regular med surg nurses don't really, know that. So that's why I, went over it with some of the ICU nurses or the ER nurses, because you can use a peripheral IV for the first 24 hours, but you could only use it on one vasopressor at a time. So, for long-term vasopressor use, meaning like more than a day, say they're on it for a week or 2 weeks, they need to put a central line in or a PIC line. And, a lot of hospitals are doing this where they're taking out central lines and they're putting in PIC lines because they feel that they are safer for infection purposes, and we can draw blood from a PIC line, but the problem is that my hospital doesn't allow that because they're trying to cut down on the amount of infections or blood clots or, things like that. Because when you have to re-stick somebody and put a new PIC line in, it takes a lot of effort. And if you have to exchange a midline for a PIC line, that can be done in interventional radiology, which causes them, to back up with other things because they do a lot of things in interventional radiology. And, so planning, and I told them that planning for your PIC lines and your midlines, don't call us at 3:00 on a Friday afternoon and say, I need a PIC line, I need a midline, patient's going home. You knew the patient was going home for 3 days, that they were possibly going home on IV antibiotics. You need to plan for these things. So planning, just like us planning for this project, takes effort, and it takes you to use your brain and prepare for it. The other thing that I, discussed with them is the flushing of PIC lines. You need to flush them at least twice a day because you can't overflush a PIC line and you can't overflush a midline because otherwise they tend to clot or they tend to, not have blood return, which you're really supposed to make sure that they have blood return before you're infusing anything. Now, the whole thing with using them for blood draws, if you get a physician to say, okay, you can use it for blood draws, then it's okay. You just need to write an order, or they need to write an order. But, we try to deter from that because we don't want them to clot. And we don't want to have to take it out and put a new one in. We had a patient one time, and I told them this. This guy had 4 PICC lines because they kept clotting, and then, and it had to be, it couldn't, I shouldn't say it had to be. It probably was from them not flushing it enough. He had a midline, then he had a PICC line, then he had another PICC line, and then another PICC line. And he ended up having to have the 4th one done in interventional radiology because there were clots that formed. Now, he did have cancer, he had lung cancer, but he did need this, midline or PICC. And, because of this, he went through such, trauma of kept getting stuck. Whereas if you just keep flushing them, and I said, you just can't flush them enough. Every time you go in to see your patient, you don't have to flush them every time, but every other time you can just flush it. It's not a big deal. You can stop what you're infusing and you can flush it that way too. Just to make sure that you're not clotting the PICC line. And, it just drives me nuts. And then, you get phone calls. Oh, I don't have any blood return on my PICC line. I say, you have to use CathFlow. And, my name's Kathy, and they used to call me Kathy the CathFlow because I was forever, when I was a staff nurse, putting CathFlow through PICC lines. Now, you cannot put CathFlow through a midline, and I had to explain that to them also. So, there were a lot of questions, a lot of interaction among me and the staff. But I do feel that I did a good job. I knew what I was talking about, and I do feel that they did learn. But will they pass this along to their coworker when their coworker went to an in-service on this like almost a year ago? I don't know, but I'd like to think, and for my future, I spoke to my manager about possibly going around with the board, or maybe just showing them a midline and explaining to them how we need to flush them, how we need to, make sure that they have a good, good flow. Because if you don't, then they're not really being used properly. I do believe they understood that, and my manager did want me to do this as a future project, and I will still talk to my preceptor because we are working on, like I said, a project about vasopressors, using them on midlines. We're looking up the education, and there are a lot of studies that say that using midlines for vasopressors, which is a peripheral IV, is a good idea. It's not a problem. And what else? I guess, just educating the staff and answering their questions and going through things with them really taught me that I can do this, and that I feel that I am doing a good job. And that's all I can do. And then at the end, when I did the questions, like I said, there was an improvement in the answers. And the questions were really simple. They weren't difficult questions. I'm not asking them about, putting in a midline or putting in a PICC. And they're very different. One's much shorter and one's much longer, and one needs an x-ray and one does not. And a lot of people don't realize that. I said a midline, once you put it in, it's good. You get blood return. It's like an IV. And a PICC line, you need a chest x-ray, and you need to make sure it's in the right place before you say, yes, you can use it. So we always write an order for them that they can use it after we get the results of the chest x-ray, which sometimes take longer than you expect, but they've gotten, pretty good. The radiologists have been reading them pretty quickly. And that's the information that I gave them, and I do feel that they did learn. And with my handout that I had them fill out, the little quiz, they, a lot of them were like, "Oh, really? We gotta do a quiz?" And I said, "Yeah, it's not bad," and it wasn't bad. And then they realized it really did help them learn, because they were thinking about it, before and after. So, and that's my presentation about my educational experience at Holy Name. And thank you.